my deepest sympathy to the people who have lost beloved ones to the virus. Let me also repeat my heartfelt gratitude to those on the front line, in health. Over the past 14 days, cumulative cases in the European region have increased 15%, and the region still accounts for 38% of cases and 50% of deaths globally. The 5 European countries reporting the highest cumulative numbers of confirmed COVID-19 cases over the past 14 days are the Russian Federation, the United Kingdom, Turkey, Belarus and Italy. Spain, Italy, the UK and France continue to account for 72% of all COVID-19 deaths in the region. Understandably, as the weeks pass, people and politicians alike are eager to reopen businesses and return to workplaces. 48 countries across the WHO European region are adjusting their public health and social measures. The most common measures that are eased first are the opening of non-essential businesses and relaxation of domestic movement restrictions. Let us remember, we are not measuring lives against livelihoods, nor health against wealth. There is not an either-or. There is no economy without people. There can be no economic recovery without COVID-19 transmission under control. Learning from the past and looking to the future, I have 3 messages today. We must recognize, first, controlling the virus and economic recovery go hand in hand. Second, COVID-19 impacts all, but some more than others. We cannot afford to leave anyone behind. And third, we can build back better, a different economy that is more equal and inclusive. My first message: the best way to protect the economy is to protect people. Europe is entering an economic recession. Economic output is set to collapse in the first half of 2020, with most of the contraction taking place in the second quarter. It is then expected to pick up, assuming the virus is controlled. According to the EU's spring economic forecast, and I quote, GDP is forecast to contract by about 7.5% this year, far deeper than during the global financial crisis in 2009, and to rebound by only 6% in 2021. This rebound, however, would leave the European economy at the end of this forecast horizon about 3% lower than the output level implied by the autumn forecast. At WHO, we are concerned that countries will respond to this crisis in the same way they did to the recession 10 years ago. Many countries in Europe responded to that crisis by cutting public spending on health. Between 2008 and 2013, public spending on health per person fell in around half of the countries in our region. Those cuts prevented many people from accessing the healthcare they needed. Unmet need for healthcare increased in 19 out of 28 EU countries, affecting 3 million more people in 2013 than in 2008. Furthermore, up to 9% of households were pushed into poverty as a result of having to pay out of pocket for healthcare. Countries that took the path of cuts to health spending struggled to recover from the economic shock, and we must learn from the mistakes of the past. Today, our priority must be to invest in health, invest in social protection, and above all, avoid austerity, which has devastated the lives of so many in Europe. Investing in health and social protection, especially when the economy is unstable, is the mark of responsible policy action. My second message is, COVID-19 has affected us all, but not all equally. The vulnerable people in society, people in informal work, people close to poverty, mothers living alone with children, have become even more vulnerable as a result of COVID-19. Yet, in recent weeks, we have seen many examples of actions by countries and communities to alleviate insecurity, reinforce the social fabric, and support health. In Uzbekistan, social allowances for low-income families have been temporarily extended by an extra 6 months. In Spain, rental assistance programs have been introduced for homeless people, and more substantive income security policies are being introduced. Volunteer organizations in Serbia have helped Roma children with distance learning. In Poland, parents with children under 8 can access an additional 14 days of childcare allowance. Unemployment benefits will be temporarily available to freelancers and self-employed people in Finland. National authorities are providing food, medical supplies and financial assistance to vulnerable people and children in Kyrgyzstan. COVID-19 has highlighted a fundamental truth. When one of us lacks health and care, we are all at risk. No one is safe until everyone is safe. And policymakers have choices, even in the most difficult circumstances. We cannot afford to leave anyone behind. So my third message is this. Recovery must lead to a different economy. We call it an economy of well-being. An economy of well-being means an economy which puts people in the center. An economy which provides a safety net for everyone and protects frontline workers. An economy which contributes to a green climate and environmental sustainability. An economy where public health is seen as a driver of jobs in the health sector, particularly for young people and women, and as the safeguard of economy, security, and peace. Beyond defeating the disease, the great test all countries will soon face is whether current feelings of common purpose will shape society after the crisis. As leaders learned in the Great Depression, to demand collective sacrifice, you must offer a social contract that benefits everyone. The leaders at that time did not wait for victory to plan for what would follow. We must mobilize the will from politicians and people alike to create a better society which is fair and safe for everyone. An economy where we leave no one behind. Thank you.
Thank you very much, Regional Director. Right, we're going to go to some questions. We're joined by panel members Katie Smallwood, Chris Brown and Dr. Sarah Thompson now, particularly regarding this focus upon and compelling arguments regarding socioeconomic impact of COVID-19. So we have some questions that came to us in advance. I would welcome and invite the press also to raise their hands in the system here so that I can see them, please, with your name and your outlet clear to me. I'd be grateful for that. So, okay, we're going to go to the first question, and I think I'll start with Rosie Burchard from Deutsche Welle. Rosie, good morning.
Hi there, good morning. Can you hear me fine?
We can, Rosie. Please, go ahead.
Great, thank you very much. So I've spoken to several hospitals here in Belgium that are seriously concerned about the health risks of illnesses other than COVID-19 going untreated or getting missed because current emergency regulations prohibit hospitals from doing normal procedures like cancer screenings. How much of a risk do you think this represents, and do you recommend governments lift these regulations where possible?
Thanks very much indeed, Rosie. I'm going to go across to Dr. Katie Smallwood to respond to that. If I could please, Katie. Thank you.
Thank you very much, Rosie. And of course, as countries have had these significant surges of COVID-19 cases, we do understand that there are other unmet needs for healthcare that may have had to be postponed or stopped, and we're still working to understand the true scale of the impact on essential healthcare delivery across the region and in specific countries, and we're working with various countries to do rapid assessments to really understand how much of the health burden has not been met and what the pent-up demand for access to healthcare will be going forward. And WHO, in this period now where countries are beginning to enter a new phase where essential health services are starting up again and looking at bringing patients back into the healthcare system in a safe way, we're looking at a dual lens where countries are really looking at how to continue the essential delivery of COVID-19 response, but also in parallel, how to restart and re-engage essential health services that may have lost a little bit of time and pick up again. But as we understand in most countries, life-saving interventions have continued. Thank you very much.
Thank you very much, Rosie, for the question, and thank you, Katie, for that answer. Right, so I'll next go over to Mariam Gigani from Imedi TV. Mariam?
Yes, do you hear me?
Yes, we do. Please go ahead, Mariam. Thank you.
Okay. Hello, everyone. Good afternoon. I would like to address this issue about the a drug called Plaquenil. I mean Plaquenil. This name is really hard to pronounce, so I'm sorry. And we know that World Health Organization suspended to use this drug against COVID-19 and to treat the patients with this patients of COVID-19. And in Georgia, we have also suspended to use this Plaquenil in our patients. However, our chief medical officials say that in Georgia, this drug has not caused any problems in patients. However, World Health Organization and the study that was published in Lancet says otherwise. So can you please specify why was the usage of this drug suspended in COVID-19 patients? Thank you.
Thank you very much, Mariam. I'm going to pass that to Katie. This regards hydroxychloroquine. Katie, I hope you got the question. You're on mute, I think. Thanks.
Sorry about that. Thanks for the question. Hydroxychloroquine, as many of you know, is one of the medicines that is licensed for other purposes, but remains an unproven medicine for the use of in COVID-19 patients. It is one of the medicines that is currently under WHO's led Solidarity trial. And given the recent publications regarding safety concerns in the use of COVID-19, in its use in COVID-19 patients, there has been a decision by WHO as a precaution to pause the use of hydroxychloroquine enrollment as part of this clinical trial. We'll do this, and we will do this temporarily while we review in detail the safety information and the safety data from patients that have been receiving the drug for COVID-19. In general, as you say, there is no proven specific treatment for COVID-19 yet, and WHO has cautioned member states and all medical entities in the use of unproven drugs for COVID-19, except in the very particular context of clinical trials. And these are trials that are such as Solidarity trial that are ongoing and that are being done for research purposes. One word of caution, hydroxychloroquine is used for a range of other illnesses and that are outside COVID-19. And there is no reason for patients that are receiving hydroxychloroquine or chloroquine for other existing conditions to stop their use. It's really in the context of COVID-19 that the safety issues have been arisen.
Thank you very much. Right, we'll go over next to Oskar Gozinski, who has submitted a question in advance, and I'll ask the regional director to respond to this, I think. The question is this: going into the summer, we're seeing countries opening up their beaches. We see that they are already getting crowded. How risky is going to the beach in the current situation? Although beaches can be crowded, they aren't confined spaces. Do we know if the virus can spread through water? Please, Hans.
Thanks, Oscar. We see this indeed in several countries. So we need two things. We need what we call responsible governance and responsible citizenship. It means that the leaders, to look at what are the data are telling us, they need to communicate with the public and understand the public. And from the citizens, we would expect that they listen to responsible leadership. It means that nothing much changed. Now that the lockdowns are being lifted, there is no treatment yet, there is no vaccine yet. So the key issue is the behavior by the people, how the people are going to behave, including, as you say, on the beach and with good weather, is going to determine the course of the pandemic. And any places where people are very closely together and sharing foods and drinks is, of course, a place which is prone for the infection to spread. So listen very carefully to the advice of the national authorities and to behave in the COVID reality. It's not so much a matter of a post-COVID, but a matter of learning to live with the virus which is there, with physical distancing, with cough hygiene and washing the hands, etc.
Thanks very much, Oskar, and for the question. Thank you to the regional director. I will next go over to Naomi Kresche from Bloomberg News. Naomi, welcome back.
Hi, good morning. Thanks for taking my question. Sort of following off the last question, here in Berlin, there's a discussion about whether to reopen clubs and bars. And I'm wondering if there's any circumstance in which it might be a good idea to open a club or a bar, or if you have any thoughts about how to do that in this kind of new reality. Thanks.
Katie, opening clubs, opening bars, over to you.
Thank you very much, Rob. And Naomi, this is a really important question, and one which is not just limited to clubs and bars, but it extends to all parts of our economy that thrive on people coming together in close environments. And as WHO has very clearly said, there are very specific criteria for countries to take into account before they start looking into how to reopen our society in a safe and sort of staggered way. So key principles here that countries like Germany, and Germany is one such country that has demonstrated over a sustained period a really strong decrease in its cases. Germany is also a country that has widespread testing, and because of that, we have a good understanding of how the virus has been transmitting within Germany and at the very local level. And these are things that are extremely important as countries start to take these decisions. So opening businesses or clubs, bars, where people do come together will absolutely have to depend on a very strong ability of the health system to know how the virus is transmitting, where it is transmitting, and then most importantly, especially if people are allowed and the decision is taken to allow people to come together in closed settings, that as soon as transmission occurs, that the health systems and the disease control systems can very specifically and in a targeted manner understand where the case is, understand who the contacts are, and ensure that targeted interventions to prevent and break any transmission of the virus can be put in place.
Okay, thanks very much, Katie, for that response. Thanks for joining us again, Naomi. We're going to go over next to Sophie Samoshia from Formula TV. We believe that's in Georgia. Sophie?
A very interesting thing. picture of what we are dealing with.
Okay, Sophie, we're not hearing you very well at all. Could you either speak closer to the microphone? We'll give it another go. Could you start your question again, please?
Yes, hello. Do you hear my voice better? Hello?
No, I'm afraid, Sophie, we can't hear you. And hopefully you can keep your hand raised if you well, I'll come back to you later in the on the call. So I'm going to go over to Interpress News now to Salom Abulashvili. Salom.
Hello. Can you hear me?
I can hear you. Thank you very much. Go ahead.
Oh, thank you very much for getting my questions. I have two questions for you today, and nice to meet you again. As you know, the Georgian economy mainly depends on tourism, which is considered the most affected sector due to pandemic. Georgia is intended to become one of the first countries that will be able to receive international tourists. How would you estimate whether Georgia is a safe country for travelers? And the second one is that people are forced to stay home because of COVID-19. That means that economic activity has declined, people can't get paid. How frequently temporary financial assistance is used in Europe? And how do you think this can be a sufficient solution for financial shortcomings for those who have lost their jobs in this process? Thank you.
Thank you very much, Salom, for joining us again. I'm going to the first question regarding tourism and is Georgia a safe country to visit? I'm going to pass over to Katie, and then with the second question regarding the financial impact of this, I'm going to go over to Sarah. So Katie first, please.
Thank you very much. Thank you, Salom, for the question. And of course, as the summer months approach, many countries that have strong tourism or tourism sectors are looking to restart those sectors in a way that's safe, in a way that all of the provisions are put in place so that tourists, when they arrive in the country, they know that they can seek care if they need to, and all of these things absolutely need to be in place, of course. In Georgia specifically, the situation will continue to evolve, and it's very difficult to predict what the situation in Georgia will be 1 month or 2 months from now. At the moment, we can safely say that Georgia has done an extremely good job at controlling the transmission of the virus, and over the past 2 weeks has only reported less than 100 cases, in fact, to us. So it's a country that has really made significant steps in being able to continue the downward trend of transmission at the country level and across the country. This, of course, needs to continue, and this will be extremely important for Georgia in ensuring that tourists come to Georgia, and this is something that the Georgian authorities will be looking to very, very specifically. In terms of tourists themselves, of course, every country needs also to be ready to be able to manage and detect and safely control any transmission from importation of cases. And as tourists travel around the country, especially in areas that are rural, are in the mountainous areas, Georgia will obviously need to ensure that both the accommodation sector, so the hospitality sector, hotels, are able to put the safe provisions in place, and that the health system is able to manage any cases of disease in the areas where tourism is a strong part of the economy. So there's a range of measures that, of course, all countries will be needing to put into place, and as the situation evolves and as the epidemiology changes, of course, we'll need to relook at what the situation is. But certainly we're looking at how to do things safely rather than preventing them from happening at all.
Very good. Thank you very much, Katie. Now I'm going to go across to Sarah, and then I'll ask Chris Brown also to reflect on the second question as well after Sarah. Please.
Hi, Rob. Thanks very much, Rob. And hello, Salome. You ask a great question. We know that countries in Europe are facing a very difficult situation at the moment. It's really the first time in Europe that a health shock is leading to a major economic shock. And we understand that countries may be facing very difficult challenges in the months ahead and may be looking for ways to cut spending on health and other sectors. One of the lessons that we learned from our previous experience of economic shocks is that we strongly advise countries that they should not cut public spending on health, and they should not cut public spending on social protection, because our research shows that this only leads to further problems down the line. I'm focusing on cuts in health spending because these can have real impacts on people. Cuts in public spending on health shift costs onto households, healthcare costs onto households, through increased co-payments, through reductions in services, and through longer waiting times. If these households, as you've specified, are already facing financial insecurity, then they are going to be put in a situation where they have choices. Do they put food on the table for their families, or do they pay for the medications that they need for their chronic conditions like heart disease and diabetes? And the health system can play a very, very important part in making sure that households who are already facing financial insecurity because they've lost jobs, because they've had their wages cut, do not experience further financial hardship. It's particularly important to protect people in poverty, people at risk of poverty, people who have lost their jobs from co-payments and other forms of out-of-pocket payments in the health system. Thanks.
Thank you very much, Sarah. Chris, would you like to reflect on that as well, please?
Thanks, Robin. Thanks for the great question. I mean, just to add on to that, every country is facing now this first wave of the economic shock, and we're seeing it in terms of employment in various sectors. What we do know is that maintaining the protection for livelihoods through social protection policies linked to housing, food, poverty reduction, active labour market programmes is really something that's worth that investment. And if I just give you some figures from our past learning, that even conservative investments of social protection policies for livelihoods can protect 250,000 lives in a country of 60 million, 10,000 lives in a country of 3 million. So the issue is really to be able to maintain these investments because it protects human capital, so that when the economy does start to bottom out and come back, we have a faster bounce back, and we have a bounce back that leads to much more inclusive economies. So thanks, Rob.
Thank you very much. Right, we're next going to go over to Gunilla von Hall from Svenska Dagbladet. Gunilla, good morning. Gunilla, you may be on mute.
Yes, can you hear me now?
Thank you, we do hear you now. Thank you. Go ahead, please.
Thanks for taking my question. I have a question about the tests to see if you have antibodies. They're becoming more and more common, and in my country, Sweden, it's quite easy to buy them. A lot of people are buying them to see if they have antibodies. How reliable do you see these tests being, and how worried are you that these tests would give people a false sense of security if they have antibodies, as we don't know how protected you really are, how long your immunity will last, or how big it is? Thank you.
Thanks very much. Katie, please, tests, reliability, antibody tests. Thanks.
Thank you, Gunilla. So WHO has said this before, and I can repeat this, that the test that should be used at an individual level to understand whether someone is ill with the virus should be a molecular-based test, which is a PCR test. The serologic tests that are available for use should be used at a population level to understand what proportion of the population has been infected by the virus. And many countries are using different tests, so it's very difficult for me to say precisely with regards to your question what specificity and sensitivity, which are the terms that we generally use for how effective the test is, it's difficult to say that without understanding what specific test you're referring to. And given that there are many tests on the market, this just re-emphasizes the fact that we should be standardizing the use of these tests and that they should be used for appropriate purposes. With regards to the use of so-called immunity passports, where individual tests are used to determine whether an individual could return to work, WHO has issued a scientific brief on that and a statement that we do not believe that tests should be used for that purpose. When it comes to the use of serologic tests and assays, WHO is also working in a number of areas to increase the standardization, both of the assays themselves, but also of the panels of serum that are used, so that we can start to compare the results of different tests being used across countries and have a bit more of an understanding of how to understand and interpret the data that we're receiving from all of the different surveys and all of the different studies that are undergoing at the moment. So this is very much work in progress.
Thank you very much, Katie. We did get in contact, finally, we've got some contact from Sophie Samoshai from Formula TV in Georgia, who's very kindly sent her questions into us. So I'm going to take...
Hello, and thank you very much for this second opportunity. My question is regarding the lessons learned. So we have already some time passed and more studies have been done, more data is available. Could you please comment, what are we actually dealing with? Is there a clearer picture about the virus itself? And the second question, Georgia is now reopening the public transport. What would you recommend to the government and the people for the safety of the passengers and avoiding the second wave? Thank you very much.
Okay, Katie, I think you've already kind of answered the second question, but maybe the first question. Did you catch that question?
Yes, I think so, Rob, and thank you. And I think it refers to what we know so far, what lessons we're learning, and what we still have to learn. And I think there are several components to this. First of all, we have learned at an incredible speed about this virus. There are more than 17,000 sequences that have been uploaded. We're understanding how the virus is changing. What we do know is we know that the virus is behaving in a relatively stable way, that the disease and is not mutating significantly. The disease is presenting in a similar way in different contexts. And we have a huge amount of knowledge and advances in who is most vulnerable, how the disease affects the elderly and the older age groups, and as the regional director said in his opening remarks, which comorbidities are most responsible for being a factor in having severe disease and outcomes. So we've learned a lot. There remains a huge amount to learn. We still don't fully understand the role of some population groups in transmission. So, for example, we still have a lot to learn about the disease in children, how susceptible children are, their role in infection, and also the role of other complications that have arisen in children over the past weeks and months. In terms of our lessons learned, how we are responding, WHO has spoken about this several times, that we are learning and adjusting, and countries are adjusting their responses on a day-to-day basis because of the new information that we're getting. WHO has a very rigorous process of scientific reviews, and we will update our guidance to member states on the basis of changes in the evidence. This refers to changes in our advice for infection prevention and control, changes in our advice for clinical management on the basis of clinical trials that are ongoing. So there are still many unanswered questions.
Thanks very much, Katie. On this lessons learned point and question, I'll also pass the floor to our regional director.
Right. Indeed, many knowns and unknowns. Looking from a macro perspective, it's so important that the society is putting the people in the center, because it's really the people who are already vulnerable who get hit disproportionately. And this can be the homeless or the people who have no job, but as much as the healthcare workers, which in many countries, West and East, are disproportionately hit by the COVID-19. So to protect the people who are protecting the sick people is a lesson definitely not to be forgotten. The next one in the same line is a minimum safety net for the people, a society which takes care of everyone. And that comes back to we need a united action for better health. We need a unity within the country and between the countries, between governments and civil society and the private sector. We see it also for development of vaccines and treatment. The unity and the solidarity, that if there is something that we have learned so far, is that one country, even if it's doing a great job, is not standing alone. We are safe only when everyone is safe.
Thank you very much, Regional Director. I might actually on this point do a little bit of a tour de table with the panel members, lessons learned. So Sarah, I might go across to you to, just for a very brief sort of reflection on that question on lessons learned to date from the pandemic.
Thanks, Rob. So I will reflect a little bit, if I may, on lessons learned from the previous economic crisis and how that's relevant to the crisis that's coming in terms of the economic shock that the pandemic is leading countries into. And I think the first lesson is that even when times are challenging and governments face very difficult decisions, it's very, very important not to cut public spending on health. And we saw that very, very clearly from the previous crisis. Cuts have really negative consequences for households, for real people. So if countries can avoid it, they should absolutely continue to invest in health, even when times are very, very difficult. The second lesson that we saw from the economic shock 10 years ago was that even in very difficult circumstances, countries were able to mobilize additional funds for healthcare. Many countries were prepared in advance, and I think this is an important lesson for countries to take now. In your health financing system, you can introduce mechanisms, you can build up reserves, have counter-cyclical formulas for transfers from the government budget to social insurance to make sure that as the economy is declining, there is going to be continued investment coming into the health sector. Countries can also act very quickly in response to a crisis, and I think we've seen that in this current, in the pandemic today. Many countries have acted really quickly to put more money into the health sector, and we encourage countries to continue to do that in the future, because health systems are going to need continued investment to protect negative consequences for people. A final thing that I want to say, another important lesson from the previous experience of very, very difficult economic circumstances, is that countries always have choices, even when the situation seems really tough. And when it comes to protecting people, to investing in health, this is something that is not only the right thing for countries to do, but it's also very much aligned with the population's preferences. There is an enormous amount of survey material from across Europe, from the OECD countries, that show that people really want their governments to do more to protect them in the area of health and in the area of pensions and social protection more broadly. So people want governments to do more in this area. Thanks. Over.
Thank you very much. And over to you, Chris.
Yeah, just one final comment, maybe on a different perspective. I think what the current learning has showed us is that when we have a crisis, this ability for sectors within government to work with the voluntary sector and peer organisations is really strong. And this has allowed us to be able to identify those most vulnerable, those who may not be able to comply with the guidance for staying safe. And that means has allowed us to be able to find people who need shelter, to deliver food to people who are suffering from food insecurity. And I think the lesson learned is that these don't just work now, they are going to be important for us for the recovery. So we can do it now, we need to learn the lesson and take that lesson going forward to make sure that we build strong, integrated services that are close to people and respond more quickly to people in vulnerable situations to keep them safe, to keep them healthy and benefit the rest of society.
Wonderful. Thank you, all four of you. Right, next we'll go over to Sam Meredith from Cnbc. Sam?
Hi, good morning. Can you hear me?
We can. Please go ahead.
Yeah, thank you. So at the beginning of today's briefing, if I've understood correctly, the regional director said that of confirmed cases reported over the past 2 weeks, Belarus was among the 5 countries recording the highest number of infections. So I wanted to ask how concerned you are about the uptick in new cases in this country, particularly since its response to the outbreak is in stark contrast with most other European nations. Thank you.
Thanks very much. Right, over to the regional director to respond to that. Thanks, Sam.
Right. Quite soon in the outbreak, we did send the WHO expert mission to Belarus to work with the authorities, which was concluded with a press briefing, which is available also on the YouTube. Since then, we have strengthened the technical support in Belarus, which is implementing quite a range of public health measures, be it indeed, as you mentioned, adapted to the national context. And this is something which is ongoing. So there is a continuous dialogue with the country where we have been stressing since the mission and even in fact before, in line with the outcome of the recommendations, the basic public health measures, including physical distancing. Also have a discussion with the authorities on the sport events and also the importance of postponing or cancelling mass gathering events. Thank you.
Thanks very much, Regional Director. We'll next go over to Christine Amira from Net News in Malta. Christine.
Can you hear me?
You can. Please go ahead.
Good morning, and thank you for taking my questions. I have 2 quick questions for you, if that's okay. The first one is, Malta has been registering fewer cases in the past few days, and rumor has it that we will be reopening our airport and it will be resuming its operations by mid-July. How big or how small are the risks of reigniting the virus in the Maltese community by doing so? And my second question is regarding the 159,000 excess deaths that Dr. Klug mentioned, which were registered in Europe in the past months. Is there an indication of any prominent cause of death in these cases? Thank you.
Okay, thank you very much, Christine. We go over to Katie. First question regarding reopening, risks of reopening, and the second question regarding excess mortality. Katie, please.
Thank you very much, Christina. And indeed, Malta has had a slowing of the epidemic with small incidents over the past month or so after an initial peak through mid-April. It makes sense for the Maltese authorities to be looking at a transition plan to look at reopening of borders. This is something that WHO would support in doing. The most important thing to underline here is that any country in reopening borders need to be very much prepared to manage new importations of cases. What we're seeing is the curve being controlled. And this is really optimistic news that countries are able to bring transmission under control. But as we know, there are still many countries that are having large numbers of cases. The risk of importation is high. Of course, opening borders is absolutely necessary for economies. And so we would encourage that Malta has in place every possible measure at points of entries, but most importantly, within its health system, to be able to pick up cases, whether they're imported or whether they're still occurring in the community, to identify contacts from those cases and to break any chain of transmission. As for the specific question around excess deaths, so this is information that we have from Euromomo, which is a network of countries that provide information on all-cause mortality. So this is deaths that are from all causes, and it's not specific to any one disease or cause of death. But what we have seen very clearly is that the peak in excess mortality corresponds in those countries to the peak of the transmission of COVID-19. So this gives us a very good indication that a very significant proportion of this excess deaths is linked and due to COVID-19.
Thank you very much, Katie. Very clear. So next we go over to Nino Siporai Supuria, excuse my pronunciation, from the newspaper Kaviris Palitra, which is in Georgia. Nino, please.
Hi, do you hear me?
We do. Please go ahead.
Well, my question is, what has World Health Organization learned from the experience of coronavirus pandemic? Are there any kind of mistakes of experience that you think can be improved in future?
Nino, I think we got that, but could you repeat it a little bit louder, please?
Are there any kind of mistakes or experience that you think can be improved in the future? What has World Health Organization learned from the experience of coronavirus pandemic?
Thank you very much, Nino. We did hear you that second time round. Thanks very much. Very clear. Over to the regional director.
Yes, very clear, Nino. There is a procedure which has been re-endorsed by the recent World Health Assembly that once that the acute peak of the pandemic ceases, there is what we call a after-action review, which is independent from WHO to learn. And then accordingly, it's up to the WHO and its governing body board, meaning the member states, to advise accordingly how to strengthen the governance for the future. And this happened in the past with the H1N1, with the SARS and other pandemics. Here at the WHO Regional Office for Europe, we are not waiting for such after-action review. Proactively, we are conducting what we call a in-action review. Why? Because there is the very real possibility of a second wave in many places, so that we learn already the lessons from the first wave for the second wave. Obviously, one issue which is really very, very acute and has been acute, is improving now and everyone knows about, was the global shortage of personal protective equipment, the masks, the gowns. So this is definitely a very, very important lessons which hangs together with the need really to protect our healthcare workers, because they are the ones who are really at the front line, together with the social workers and people in other services, very, very close to the people. But again, I would like to repeat here the message I was giving in the statement: no one is safe until everyone is safe. So the need for solidarity, which we have been seeing growing through the pandemic, but which was definitely not where it should be at the very beginning, is a lesson to be taken into account.
Thank you very much, Regional Director. Next, I'll go over to Ryan Hooper from PA. Ryan, welcome back.
Hello, yes, thank you very much for that. I think just to pick up on something that Dr. Smallwood said earlier, just to be clear, please, while we wait for a vaccine and or a treatment, does that mean that there is little realistic prospect of large social gatherings without an effective track and trace system? And if I may, to the regional director, please, what concerns do you have about the efficacy of government messaging when senior advisors and politicians themselves are deemed to have broken the lockdown rules, as in the case of Dominic Cummings in the UK? Thank you.
Okay, so Katie, we go to you for the first question, please.
Thank you very much. Yeah, I can be quite specific here. So a strong surveillance system, which would include the ability to identify cases and their contacts and to quarantine contacts and follow them up for the period of their incubation, will be essential during this period, in the next period, and even when we have a specific treatment and a vaccine, if we're still seeing outbreaks caused by COVID-19 at that stage. So this is a core component of any response, and it should be in place in countries in all transmission scenarios. And we've talked about the different transmission scenarios very much in the past few months, but when we get to contexts where countries have been able to control their community transmission and bring it down to clusters or even sporadic cases, or to situations where the only cases that they're seeing are imported cases, the ability for for countries to implement robust, functional, and rapid surveillance of cases, identification of contacts, and follow-up of contacts will be crucial in the ability to maintain interventions at a targeted level. And this will prevent countries and prevent communities from having to implement, again, widespread, broader measures for community-wide social and physical distancing. So really, surveillance systems, the ability to respond quickly, to identify cases, to isolate them, and to follow up contacts will be crucial in avoiding us to have to reinstate some of the measures that we have been taking in the past few months. Thank you very much.
Thank you very much, Katie. And over to the Regional Director for the second question.
Right. What I see here, Ryan, is that there is a need for two elements. One is what we call responsible governance. It means that the leadership is listening to the public health and epidemiological data, communicates with the public, and very important, to build trust. Like, for example, we have been seeing in most of the, or all of the Scandinavian countries, this partnership between the people and the politicians. And then second, we need responsible citizenship, which means for the citizens to listen to trustful, responsible governance. Thank you.
Okay, thanks very much. We're going to go over to Tom Magner next from Carers World. Tom, welcome back.
Thank you very much indeed. Had some mic problems last time, but good that I'm back in. Just picking up on that last question, you're saying that countries need to respect people and that people should trust the authorities. The UK government still believes in austerity. Austerity is allowing businesses to reopen without making sure that arguably reliable anti-COVID-19 measures are physically in place. And beach overcrowding shows there's enough personal thoughtlessness around to override any health message. So how socially responsible is it for a government to put the economy first and the vulnerable second in these demonstrable ways?
The regional director, please.
Right. Since the very beginning, this has been a balance between protecting the health of the population, economic and social implications, and the well-being of the population. And we have issued, in fact, crystal clear guidance on countries how and when to transition out of the restrictive measures, that it has to be driven by public health and epidemiological data, number one. Number two, really to listen to the people, the voice of the community. No, any pandemic has been pushed back without a whole of society approach. The third one, the health system and the public health has to have the capacity to deal, identify, isolate, test, track, trace, treat, and need to be very important, very well and enough resourced. So these are key elements that need to be in place for countries to consider to move out of the measures. The two keywords are gradually and carefully, with a flexibility to cycle a little bit forward and a little bit backward, to impose and release restrictive measures.
Thank you very much, and thanks for the question, Tom, as well. So I'm next going to go to Judith Jansky from Club Radio Budapest, who has submitted a question in advance to us. Is there any cooperation between Hungary and WHO on the treatment of coronavirus regarding the hydroxychloroquine, of which Hungary has stockpiles and banned its export earlier? We had a question earlier regarding hydroxychloroquine, but Katie, maybe this is a bit more specific. Maybe you could respond to that question. Thank you.
Thank you. I think there are several components to this, and I won't repeat what I said regarding the safety concerns around hydroxychloroquine in the use of COVID-19 patients. Only to add that in the specific case of Hungary, and of course it's not a specific case, several countries have imposed export bans on essential COVID-19 items such as personal protective equipment, specific medications, and other commodities that have been perceived as being or in short supply. WHO has been pleased to hear that over the past couple of days, several countries and the European Union countries have released some of these export bans and that trade will be occurring. But in terms of hydroxychloroquine specifically, again, just to reiterate that WHO's advice is that as an unproven treatment for COVID-19, it should only be used in the context of clinical trials and under very close medical supervision as a treatment that is still under research and is currently paused in the context of the Solidarity trial.
Thank you very much, Katie. And finally, as we approach maybe one more question, so we'll go over to Carlotta Gull, who's with us today. Carlotta?
Hi, good to hear from you. Thank you. I'm in Istanbul, but my question is actually about Idlib, northwest Syria. I understand that WHO has supplied test kits for them, and they've done, when I last spoke to people, at least 500 PCR tests, but not a single case testing positive. Some people are questioning, is that normal? It's surprising that they haven't had any cases. And is there a concern at all among you that tests you provided were not sufficiently, were not, whatever the word is, correct or working? Or do you have any other answers to what's happening in Idlib? Thank you.
Thanks very much, Carlotta, and thanks very much for joining us. We go over to Katie for a response, please.
Thank you very much, Carlotta. And of course, Syria is in the Eastern Mediterranean region, but through the WHO Europe office, we provide specific support to northwestern Syria in the context of the UN Security Council resolutions that are relevant to that. We have a team that has been working out of Gaziantep in southern Turkey to support WHO's humanitarian response. And through that, we've been working with a range of systems in place in northwestern Syria for the early warning and response to epidemic diseases. And it's been an extremely strong collaboration with health authorities and local partners. And we've picked up a range of outbreaks that have occurred, such as measles, the polio outbreak back in 2014. And we've been working with teams on the ground in northwest Syria, specifically in the area of testing severe acute respiratory illnesses in the context of influenza. And so we're quite confident that the capacities in northwest Syria are there. We have indeed provided testing kits, and we're in collaboration and in discussions with them for any positive tests to then be confirmed with other laboratories and reference laboratories in the European region. So indeed, we've not received any positive samples from northwest Syria, but we are working with the teams there, and as soon as there are indications of any suspect cases or confirmed cases from the lab testing, we'll be following up specifically with partners there. Thank you very much for the question.
Thank you very much, Katie. Okay, so we're at the top of the hour. I'd like to thank everybody for joining us today. Thanks also to the panel members and to the regional director for responding to those questions. And it only remains for me to say thank you very much and take care. And until next time, goodbye.